Hi, this is Terry Kuti. Welcome to the Deep Sea Foundation educational channel, where we talk about topics related to breast reconstruction for those affected by breast cancer. I'm joined by my guest today. Her name is Nikki McCoy. Welcome to the program, Nikki.
Hi, thanks for having me, Terry. I'm happy to be here.
Yeah, thanks for taking the time to join us today. I really appreciate it. Nikki, you have a genetic mutation that I'm going to let you tell us about. It puts you at higher risk of getting breast cancer. You've made some decisions based on this, so I'm going to let you tell your story and field some more questions to you as we go along.
Sounds good. So you may have heard about the BRCA genes that we all have in our body, the 1 and 2. When you have a mutation in that gene, it does increase your risk of developing cancer. It's also a little bit about your family history. So for me personally, my grandmother and her sister both died of ovarian cancer in their mid-40s. My father has pancreatic cancer. His brothers have prostate cancer. Their daughters also carry the BRCA1 gene, mutation, which is what my family line carries. And one of those women had developed breast cancer at the age of 30. So for my family history, my lifetime risk of developing ovarian cancer was up to 64% and breast cancer up to 87%. I have taken the steps to take that 64% risk of ovarian cancer and drop it down to lower than general population. So that feels really fantastic. And now I am on my journey to drastically reduce that breast cancer risk as well.
So for your ovarian cancer risk, to reduce that, just briefly tell us about that, and then we'll move on to what you're doing.
Sure. So there's not really good screening techniques for ovarian cancer. So the recommendation is for women between the ages of 35 and 40 or past the childbearing years to have an oophorectomy and have your ovaries removed. So that is what I took care of. And so interesting with the BRCA1, as I mentioned, I got it from my father. Some people think breast cancer, ovarian cancer only, but it's always a good reminder to know that our daughters and sons are just as likely to carry this gene mutation as our fathers and mothers. So I just wanted to touch on that for a moment as well. And so now that the ovarian cancer risk is gone, I'm ready to concentrate on my breasts. I have been doing the recommended screenings, which is every 6 months to have an MRI and mammogram. And that takes a lot of time, a lot of money, a lot of anxiety that goes along with each of those scans. So for me, the right decision is to go ahead and move forward with a prophylactic mastectomy followed by reconstruction.
You know, I have to write off of a couple of points you said. I'm very glad that you mentioned that everyone carries the BRCA gene. Mm-hmm. It's when you have a mutation in that gene that you need to be proactive about your health. I'm also glad that you mentioned the fact, Nikki, that this can be carried by our fathers. It can be dad's side. And in fact, you know, over 2,500 men a year get breast cancer. And so we need to be aware that that gene doesn't just come from the maternal side. So thank you very much for bringing both of those points up.
Yeah. So,
yeah, I just, you know, I'm curious to know what you've done now to move forward with the decision to do reconstruction. What type have you decided on? How did you go about all that? It's not an easy process, is it?
No, it's not. And it's very, very overwhelming at first. And my first and foremost starting point is to meet with a genetic counselor. Some women are finding out about their gene mutations through like direct to consumer kits. And it can be really hard to receive that information without having a licensed professional to help you walk through those implications. So I had genetic counseling and genetic testing done, and my genetic counselor was definitely my core starting point for national guidelines, for recommendations for specialists in my area, and then also for some online resources and other resources such as, how to talk to your family members about this, including children. So that's where I really started, was like knowing that I need to just really start gathering information. It was incredibly overwhelming. Once you kind of reconcile with the new information, then it's time to take action. So using those resources that were given to me, finding out about places like FORCE, Facing Our Risk of Cancer Empowered, a nonprofit that deals with hereditary cancer risk. And from there, seeing that there's whole communities around breast cancer. And then, of course, being a person in America or the world today, social media is a great place to start to connect with others. And so I just started finding all of these different resources, especially in the Facebook community, including the DIEP Foundation and page on Reconstruction. So once I started to learn from all of these different places what types of surgery and reconstruction was actually available, I was able to understand what was best for me. So I did consult with someone who specializes in plastic surgery and implants. So I learned all about the different types of implants that may or may not work for me. And then I also consulted about tissue reconstruction, using your own tissue to replace that breast tissue that you'll lose during mastectomy. And ultimately I decided that using my own tissue was the best choice for me. So I'm really excited to be planning my DIEP surgery or reconstruction.
Well, again, you brought up some great points. I'm really glad you mentioned about the genetic counselor component.
Mm-hmm.
When I had my genetic counseling too, when I had my genetic testing, I think that is a very important point that you made, because just getting the test and knowing what gene mutations you may or may not have, it goes way beyond that. It gets a little bit more complex, and you have mentioned the element of the studies and talking to your genetic counselor about all that. So I really am grateful that you brought that up, Nikki.
Mm-hmm.
I'm also really glad to hear that you looked at all your options. What was it? Because it's so personal what women choose. Implants, autologous base, which is using your own tissue, or a combination thereof.
Oh, right.
Mm-hmm. I mean, what drew you to the DIEP lab and using your own tummy tissue?
Yeah, I really appreciated the idea of having a natural appearance. I know that a lot of implants also can appear natural. So for me, it was not only kind of the aging factor that like your tissue will kind of age with you and seem more natural, for your body type, maybe when you're in your 70s and 80s, but also the feeling that can come along with it, because the tissue will be warm when you take out all of your breast tissue. So for instance, like my cousin has implants and she looks fantastic, and she's let me, take a look and kind of feel, and hers are warm because she has her own tissue along with that implant. When you take out your tissue for mastectomy, there's nothing there but the implant. So you can hear it, you can feel it, it can be cold, and it can feel a lot less natural than, say, if you were to just, reach down and grab that tum-tum. So that for me was a big appeal. Another piece of it is that for implants, it takes, you need to have, you need to go in and check on them quite often. And so for me, this felt, the own tissue felt like a kind of one and done surgery that I won't need to be monitoring for years. Because a big part of this is I would like to have this behind me and be at peace with knowing that I'm healthy and whole.
Yeah. Well, yes. And I mean, you know, the difference between implants and using your own tissue, there are differences or similarities. There are differences. Really good that you brought up the fact that from what I'm understanding, your cousin had augmentation, correct?
Correct. Yes.
Yeah. So it's different, like you said, when you have a mastectomy. You're not going to get that. You're going to get a little bit more temperature variances, especially they can feel colder. Also, it's important for the viewers to know that breast reconstruction is not a procedure, it's a process. And so whether you choose to have implants or use your own tissue, it's very likely that you're going to have additional surgery. Now, you know, the initial surgery, maybe you can tell us what you've learned, Nikki. I mean, the initial surgery is longer. So yeah.
Yes. So the initial surgery is a lot longer. Your recovery time is a lot longer. And you're right, you will need maybe 2 or 3 or more revision surgeries where you're fixing some of those pieces that may not have come out aesthetically quite how you wanted or the surgeon wanted. And so yes, it's not necessarily one and done. But I think the difference is,
I know what you're saying though. I think what I heard you saying, it's tissue for life.
right. Yes.
I understand
Yes.
completely. Yep.
So I think less complications in the long run, right? Like no worrying about any implants leaking or needing to be replaced, that type of thing.
Right. The monitoring is definitely different between implant and I hear exactly what you're saying. What's your sage advice? What's your sage advice for young women like yourself who have found that they have a gene mutation of any kind and it puts them at higher risk for breast cancer? What's your sage advice to wrap it up today?
Know your family history. 1 in 400 people carry the BRCA gene mutation, especially if you're Ashkenazi Jewish heritage. It's 1 in 40 at that point. So definitely knowing your family history is very important. Doing your research. It feels sometimes like this needs to be a rushed process. Take your time, talk to people, feel the implants, feel the tissues, you know, watch the videos, do all of the things, and then be at peace with your decision. It's not easy, but once you know, you'll know, and use that for all it's worth and continue to feel good about the decisions you've made.
When I look at your face, I can tell you're at peace with your decision.
Yes. And it's a wonderful feeling. It's a wonderful feeling.
That does not happen overnight. So
No.
No, it doesn't. You gave some really great hints today. And I think one of the things that I appreciate the most about having patients, I feel that it's become an untapped but gathering strength in the fact that your voices now, I mean, you know, opening this foundation, I'm all about education, but to me, patient voices, we're amplifying that. We're amplifying the ability to educate others. So I want to thank you for being on the program today and being that voice.
Yeah, thank you. It's my pleasure. And thanks for all the education I've gotten from you as well. It helps.
I've kind of enjoyed getting to know you, Nikki, and we may have to revisit this when you are on the other side of your breast reconstruction. I wish you all the best.
Thank you. I'll keep you posted.
Thank you so much for joining us today. If you have any comments on this video or suggestions for other topics you'd like us to cover, please let us know at Deep Sea Foundation. Nikki, thanks again for joining today.
You bet.
Take care.